So when you were doing MBBS, how did you start navigating your journey forward?
Once I completed my exams during the internship, I started working as a junior doctor in Mumbai in the ICU. Worked for a year. While I was working here, flew to Australia, gave the AMC clinical exam, and then secured the job after that.
How aware people are about this Australia pathway?
So when I applied, when I was going through the whole journey during my final year MBBS and even later on, there was nobody on the pathway. They are not looking at your marks. They are not looking at how good you were during your med school.
Can you tell us about how is life in Australia?
Speaking of expenses, Australia is expensive. Mind you, everyone, Australia is very expensive. And if a packet of chips costs you 20 rupees in India, it's going to cost you 100 rupees in Australia.
We have a special guest today with us. Is there a culture of doing USMLE?
USMLE is very normal.
Getting into MBBS, how did your life change? So here we have Dr. Divij Sharma. He is currently in his training in Australia, and we are going to learn a lot about how the journey for IMG's work in Australia. He did his MBBS in India and he has done his journey and has been in the training. So for all the aspirants who want Australia or are considering during their MBBS, Dr. Divij Sharma is going to answer our questions today. So Dr. Sharma, if you could introduce yourself and tell us where you are, what are you doing currently, at what stage in the journey you are.
Thanks, Aditya. Thank you so much for having me. It's a pleasure to be on your podcast. Been wanting to connect with you for very long, primarily due to our interest in neurology. So I have been in Australia for about 2 years now. I'm currently into medicine training, and how it works is I went through the standard pathway, which is why giving AMC 1 and AMC 2, got an RMO job or equivalent of a FI2, or we call it a junior clinical fellow job. Worked a couple of years as a junior doctor or in non-training position, and then graduated my way to medicine training.
Okay.
And
all right.
yeah.
So if we go back to India, so for someone who is doing MBBS, can you tell us step by step on how it moves forward? So when you were doing MBBS, how did you start navigating your journey forward?
Okay, so I'll give a bit of my story first and then tell you what the common pathway is and what the commonality is. So for me, my journey started in late final year when I started exploring different pathways, and Australia obviously was the most interested one. During final year, I started accumulating information on how to go about the pathway, how to become eligible for standard pathway, what the cost of exams are, etc. Also, try to polish my CV, try to pursue activities which help me improve my CV as compared to other people, so that whenever I apply for a junior doctor position or a job, I'm able to stand out along with the exams. I cleared my exams during my internship. My first step was during my last phase of internship, along with my English competency exam. So it's either OET, IELTS, or English, 3 exams, which either one of you that you can give. My personal preference would be to give PT because it's the cheapest and the simplest one. However, I went ahead with the OET. Once I completed my exams during the internship, I started working as a junior doctor in Mumbai in the ICU. Worked for a year. While I was working here, flew to Australia, gave the AMC clinical exam, and then secured the job after that.
Okay.
So it was via the standard pathway.
Okay, so that is, so basically from my understanding, it's AMC 1 and AMC 2. And I think AMC 1, did you give it in India or did you give it in Australia?
Yes, your understanding is on point. So AMC 1 I gave it in India, and AMC 2 exam is only conducted in Australia, in Melbourne. That's where I gave it. The catch is that you need not complete or finish or successfully pass your AMC 2 to get a job in Australia. You are eligible to apply for jobs for these junior medical officer jobs in Australia right after AMC 1 in English. And that's the part, and that's what I did. I got a job based just on AMC 1 in English.
All right. Okay, so that's interesting. So how is this process of finding this job in Australia? Because from what I have heard when I was thinking about different options, that it is really tough to get these kind of jobs, especially at the place you like. So what are your options like what is the process of application? Can you please tell us about that?
Sure. So the options just that you apply for a hospital medical officer or resident medical officer position. It goes by the name. I mean, there are a lot of confusing acronyms out there, but you go by the names of HMO, RMO, or GMO. If you go by the standard pathway, or let's say by the competent pathway as well, which we can talk about shortly, these are the positions that you're eligible for. Now, how to go about applying them is it's challenging. It's tedious because Australia has different states. Every state has their different rules, and every state has a different website for jobs. For this HMO, RMO, JMO jobs, every state has a different website. So you are essentially monitoring, applying, revising your documents on 6, 7 different websites, and you need to be in tune or up to speed with whichever dates their JMO applications come out or the hospital medical officer applications come out. So that's the process, which is tedious. It's highly challenging, and it's a very time consuming. And by time consuming, I mean that while you're applying, you've got to re-edit your CV every time. You've got to make some fine tuning changes on your cover letter, tinker a bit with your selection criteria, change the name of the hospital here, put it to another hospital, because you're essentially applying to, let's say, more than 10 hospitals at one time. Thirdly, the process, while it's exhaustive, the application recruitment process, the shortlisting itself is very challenging. It's getting more competitive every year, not to sugarcoat it, but if I were to say honestly. However, the positions are still widely available. People I know, people whom I've interviewed, and people who I've given advices or mentored are still getting interviews, though few and far between. Less prevalent than how it was in 2022 and 3. That is when I applied, but people are still getting openings. And how you apply is Australia's hospitals are located in different geographical places, in the sense you've got hospitals in the cities, you've got hospital in regional places, which I would say 4, 5, 6 hours away from the city, and then you've got hospital in rural places, which are in far-flung areas which is essentially very, very far from the nearest airport, I would say. Regional and rural places are much easier to get than hospitals in the cities. Not to mention, there are hospitals in the cities which are also IMG or International Medical Graduate friendly, where you can get positions. But the thing is, often for all these 3 hospitals in different geographical locations, you need not shy away from applying anywhere. Just because a certain hospital is more IMG friendly doesn't mean you aggressively apply over there and neglect other places. You've got to apply evenly, if not evenly, then obviously more sincerely to the regional hospitals, but do not forget the hospitals in the cities. When you're applying, and especially you're applying to 6, 7 different websites, apply broadly. Apply very broadly, because the market's changing, the competition is increasing, and the recruitment process is very dynamic, very volatile.
Okay. So, to be very honest, I don't know a lot of people who have been in the journey for Australia. So, in my college, I remember 3 or 4 people went to Australia. So, how competitive do you think is, and how aware people are about this Australia pathway in current times?
Sure, interesting question. So when I applied, when I was going through the whole journey during my final year MBBS and even later on, there was nobody on the pathway. I figured out everything on my own. I researched everything on my own. Of course, I had some help from some folks in Australia and a couple of coaching institutes, but I had nobody with me while I was interning or I was studying on the doing the Australia pathway. A lot of the interns were interested towards the UK pathway, lab, USMLE, NEET. That was the prevalent scenario and the temperament at that point. Now, since let's say about a year and a half, the market's changed. People are becoming more aware of the AMC pathway. Still, a lot of it's uncharted. It's not explored. They have some information as to how to navigate the exams, but how to navigate the job market, the positions, the application requirements which go behind a job process, they're still up in the air. People are still getting up to speed about this information.
Okay. So, from all the people that you've discussed with, and since you worked there as well, like what kind of a CV are they looking for when they are giving jobs for these RMO, GMO positions? Like, what is the requirement?
It's very simple. They are not looking at your marks. They are not looking at how good you were during your med school. They're not looking at that. They want a very balanced CV, and why is it, and it really reflects in how they are as an individual, and not just Australia. I would say the same for UK and America as well. They don't want your academic laurels. They don't just want your academic laurels. They want everything else as well. They want your CV to be balanced. They want you to be doing something else, for example, research, presenting somewhere, so much as volunteering somewhere, and it speaks volumes about what you're doing outside of your clinical skills. Your soft skills matter a lot. I mean, your soft skill in the sense how your soft skills are enabling you to be a better doctor or a better clinician. That's what matters. So if you just include something like gardening, which is your favorite thing to do on your CV, that will not fetch so much points as much as if you put how gardening. Let's say if you try to express it in a different way, how gardening has actually enabled you to be more disciplined and more structured in life, which has reflected in your clinical practice. If you put it across that way on your cover letter on a section criteria, that comes across as someone who's really balanced. So they're looking at these few other factors, the research thing, your soft skills. They're looking at your courses which you've done, of course your qualifications. The more the merrier. You've got more exams to your kitty, if you've got more qualifications, naturally you're considered for higher positions and for a better salary.
Okay. So that's an interesting perspective. And for those jobs, and what are the interviews like over there? Is there a panel which interviews you? Is just one person doing the interview? How is the interview process like?
Yeah, great questions. The interview, there's a panel essentially. So the panel usually comprise of one doctor or one senior doctor who's going to essentially be your supervisor. The second one is a person from the HR or the recruitment. He or she could be the recruitment manager, the HR person, the HR person, or someone who handles the visas and everything. And third person on the panel could also be a senior doctor, or also could be someone from the HR, someone who's a doctor but also handles a lot of non-academic stuff, essentially to deal with the recruitment. And the interview process is this is one-off interview. You do not have multiple rounds of interviews, and I would like to divide the interview into three parts. There are categorically into three parts. First one would be to tell about yourself, what skill set do you bring, what are your long-term, short-term goals, etc. Second would be a bit of ethical part, where they include a couple of ethical questions as to what do you think as a junior doctor will you do in this scenario, how will you navigate this, if you were to have a quarrel or fight, how would you manage that. And third would be a clinical scenario, which is the predominant part of the interview, where the most amount of time is spent, where you're asked clinical questions, and they could be anything. Could be from obs gynae, could be anything from emergency medicine, but at a basic level, let's say at a intern or a PGY2, PGY3 level.
So what do you think that, how many interviews did it take for you before you finally got the job?
So I got 6 interviews actually. I failed my first 2 interviews. I mean, I was unsuccessful on my first 2 interviews. That was from India.
Yeah.
Yes, and the remainder 4 interviews I got in. So I had to select which place I want to go to. I had 4 job offers in the end after AMC 1 in English, and the whole process, it took me more than a year. I mean, it took me about more than 10 months of applying rigorously to all the websites as I mentioned, and doing my CV again and again.
Yeah, I think it's a learning curve that we have to kind of self teach ourselves, because I think every journey you can find mentors. There might be people who could tell you what to do, but at the end of the day, you are the one who is going to hit the ball across. So you have to get into shape, I think.
Mm-hmm.
And not only that, but with these interviews you got, about these 6 interviews, were they in cities, were they in rural areas? Where did you finally end up getting the job?
So 2 of them were from cities, and the four of them were from regional areas. I mean, regional as in, I would say 2 hours away from the city, 2.5 hours, not that distant or far flung. But yes, and I finally took a job in this, if you'd call it, I took a job in the city. I took a job in Perth, which is one of the metropolitan cities in Australia.
Yeah.
And yes, I was a national.
Okay, so that's amazing.
Yeah.
Yes. So you finally got yourself into a very competitive state where you finally got a position in the city where you might have actually wanted it, right?
We also,
So
because the city
that's
offered me
amazing.
a higher package compared to the other
Salary.
places. Yes.
Okay,
Yes.
so that's really interesting.
Yes.
That because in cities, it's the field. Our field is one such field where the regional places offer more salary for
Exactly.
some reason,
Exactly.
and the cities offer less. But that's good that you got the city and a better paycheck.
Yeah.
So that's amazing.
I mean, alluding to
So
your
once you
point,
got the job,
yes,
yeah.
alluding to your point
Yeah.
of you be getting more incentives in regional area, that's actually very important in Australia. In Australia, they're actually looking for more doctors in regional and rural areas, and that's where most of the hiring takes place because they want to keep you. Not a lot of doctors, specialists, GPs, or junior doctors want to travel far away. Hence, the hospitals offer incentives. The incentives in the sense they sponsor your PR, that's your permanent residency. They sometimes, I've heard, they offer you a house, they offer you a car to travel and navigate, doing up and down the city if you want to, and many more. These are they give you a food card, a food coupon, sometimes some travel reimbursement, and that's what they do to keep you to keep you there within themselves, among themselves, and hire you. And that's where most of IMGs should look to apply because they are hungry for doctors. And Australia is having a deficit as we speak of GPs, statistically, of GPs and doctors filling the right positions everywhere.
Okay. So that's an interesting perspective when some government is doing so much for the doctors in regional areas. It definitely shows, as you said, that they are hungry for doctors and it is a dire need in which they are in. So it is a good option for people to explore who are currently doing MBBS who want to move away to some different country. And I really want to get into the next part of your journey where how is the transition from RMO to a person who is in training eventually, and then how do you get your specialty? I really have no clue about it, so I would be happy to learn it from you.
Yes, thanks. So I'll speak about medicine, and it varies. The frustrating part is in Australia, it varies for every specialty. Emergency medicine has different years of training. Pediatrics has different years. GP and psychiatry have different years. So medicine, how it goes is before you enter into any specialty training, and Australians, they don't call it PG there. They call it training. They call it a training pathway. It's as simple as a training pathway, nothing else, and that's the term which they use. So before you get onto any training, medicine, surgery, pediatrics, etc., you've got to work as an RMO or a junior doctor for a couple of years. One being minimum, max could be anything depending on your circumstances, depending on your application and whichever specialty you are applying. For medicine, it could be anywhere between 1 to 2 years. For surgery, it can go up to 3 to 5 years. People who
Okay.
work as an unaccredited registrar for 2 3 years before they actually get on a standard training pathway. So how it goes is you're working as a doctor, then you apply to hospitals for the medicine training pathway, which is called as BPT, Basic Physician Training. It's the same interviewing process. You get on. There's 3 years of medicine. Towards the end of third year, you give your theory and your practical exams, also known as RACP exams, which is Royal Australian College of Physicians. Once you clear them, then you apply for advanced training. Now, advanced training is equivalent to super specialty in India or fellowship in America, as you call it. So, advanced training, if you want to apply, let's say gastroenterology, neurology, cardiology, and that's known as advanced training. Going through the same application process again, which means applying with your applications, with your CV, with your cover letter. Some specialties have a point system, and by point system, I mean everything that you do during your medicine training or during your RMOship has a point. For example, if you presented somewhere as a doctor, it will fetch you 2 points. If you have served in any higher position in your hospital, it will give you 5 points. Just speaking hypothetically, and that point system helps you apply for advanced training. Naturally, higher the points, the more chances of you getting noticed and getting an interview. And
Okay.
interview is essentially
So
the
that's
same,
fair.
talking about how you are ensuring that you're a fit for them, ensuring you're not psychotic, and probably asking a few questions on whichever specialty you want to do. If you want to do neurology, they'll probably ask you how you managed a complicated stroke patient during your medicine training, how would you manage a seizure, etc., etc.
Yeah, okay, that's fair enough. But how long is the advanced training in Australia for different fields? How does it look like? Neuro, how long is it?
Neuro is 3 years. It's 3 years. Cardio is 3 years. Gastroenterology is 3 years. Nephrology is 3 years. Geriatric medicine, infectious disease, everything's 3 years. It's 3 plus 3, just how we have it in India, except that you've got this
Okay.
1, 2 years or 3 years of preliminary training, if I may, before you actually get on the training pathway.
All right. So that's interesting. It's similar to India in
Yeah.
those ways. Now, I want to get into the lucrative part of it. That what is the salary structure for RMO versus training versus when you pass out, when you are in advanced training and when you become an specialized or
Yes. So their salary increases exponentially every year, depending on what year of working in Australia you are. So as a first year, and again varies on the state. However, I'm going to quote a broad, arbitrary figure, which would be about anywhere between 6,500 to 7,000 Australian dollars, is what you get as your first year of junior doctor training or non-residency training. And as you keep progressing years, it goes on to hike to the point where, let's say, if you are in third year of medicine, that is third year of specialty training, your salary could be anywhere between 8 to 8.5 to 9,000 Australian dollars a month. And if you are in advanced training, it's gonna be around 10,000 Australian dollars a month. Okay.
okay.
And once you
And
become
then
a
once you're out,
physician or once you become a consultant, I mean, there's no limit depending on whichever hospitals you've got public appointments in, whether you decide to, liaise with someone in private practice. That's a complete different salary figure, which I myself do not know yet.
okay, all right.
Yes. But you've got a designated salary for doctors in non-training, doctors in training, and doctors in advanced training. That's fixed. There's no way around it. Every state has a different salary figure, not by much, but yeah.
Okay. So, Divij, I got an understanding of the process, how it is working. Now, I really want to drill down into the idea of visa. How do you get a visa as an MBBS when you are coming for a job, and how does it get translated into PR, and how does it move
Sure, that's a
forward?
very valid and relevant question, because I'll tell you why. Because your training pathway, a few of the training pathways that you pursue, for example, surgery, medicine, etc., some of them require you to have a PR. I mean, it's a requisite. If you're an IMG and you have a PR, it's easier for you to get onto training as opposed to an IMG who has everything, has all the work rights as well, but not a PR. It's a bit confusing and challenging. Nevertheless, so the process how it goes is, when you apply for your first job, you are eligible for work visa, and this visa is something which the hospital sponsors for you. It used to be called by some other name before. Now it's known as TSS 482 visa, temporary short term 482. It's a
Okay.
work visa which entitles you to work for 2 years. It's subject to renewal. You can renew it as many times as you want, based on your employer's preference and their wants. Now, this temporary visa or work visa can be changed, can be upgraded to a PR visa. Now, the eligibility criteria for a PR is that you need to have general registration with APRA. And general registration means you need to clear AMC 1, your AMC 2, and have about 1 year of work experience in Australia. If you've got general registration in whichever
Okay.
state you are, be it Tasmania or Victoria, you're eligible for permanent residency visa. The process is long. It's not confusing, I would say. It's a little exhaustive, because you apply for PR through let's say you apply for two kinds of PR. One's another category, one's a state category, one's a whole Australia category. Now it's complicated because Australia has these 8 states, and each of these states have different rules and laws regarding doctors, lawyers, other jobs as well. Hence, when you apply for PR, there are two kinds of PR that you apply to. One's a state-sponsored PR or state-sponsored visa. Another one's the whole pan-Australia visa. Whichever you get first, your file gets automated to that category, and then you go ahead with the process.
Okay.
The good thing is
All right.
that the hospital is very supportive of it. So let's say if a scenario plays out that your work visa is to finish, and you have applied for a PR visa, then you automatically go on a bridging visa. and the hospital, your employer and the country understands it. Just because your work visa is exhausted doesn't mean you cannot not stay in Australia. You definitely can, because you've already applied for a PR visa and you're just waiting for an approval or a disapproval, whatever. There's something which is outside your hand, but that doesn't hamper your work rights, doesn't hamper anything. If your kids are in school, they stay in school. You have a house, you keep the house, nothing changes.
Okay. So this is really interesting that the government is supportive and the hospital administration also is supportive
Yes.
for your cause. And in a way, it is much more straightforward than it is for other fields in Australia, because I have a few friends who were into engineering or finance and they had a bit of a struggle when it came to visa. But I think that for physicians and doctors, they have a better and an easier pathway, I think, to succeed. All right, so that is interesting. Now we have spoken a lot about how the process and got into the professional details of it. But can you tell us about how is life in Australia? Our people would be really happy to know that, because they are moving there in their 20s. Like, how is it? Like?
Yeah, sure. Before I dive into my life, let me tell you that once you're in the system as a doctor or anywhere in the healthcare, as a nurse as well, Australia is very supportive of you. It's just that there are barriers of entry in terms of getting
Okay.
in. Getting in is, as I mentioned, highly competitive and challenging, more so during this environment. But once you're in the system as a doctor, as a resident, as a registrar, as a trainee, it's very supportive of you. It's very conductive, both the government and the hospital as well. Now get on to life. Yes,
Okay,
life's
that's
it's great.
interesting.
It's full of let's say wilderness. We've You've got excellent, I'd say, work-life balance, incredible working conditions in the sense, great hospitals, well built. All your staff is supportive of you. Your managers, your supervisors are supportive of you. If you're lapsing anywhere or facing any kinds of trouble, professionally or personally, they ensure that you seek help, even if you try to push it off or just fester it. They ensure that you are seeking whatever kind of help that you need in terms of improvement or in terms of other forms of help personally. But there's a lot to do, there's a lot to explore. You've got the chance to explore beautiful cities all across the country. The shortcoming is that every city is quite far away from each of them, so you need to actually take a long flight to get on there, which can be expensive. Speaking of expenses, Australia is expensive. Mind you, everyone, Australia is very expensive. Even though you think you're earning in great dollar, and the
Alright.
great dollars amount to a huge number of rupees as well if you convert it. But even after that, it's expensive. Real estate, what I used to pay here is much more than how we pay in India. Groceries are expensive, and you actually feel the pinch of inflation here more so in, let's say, more than in India or Pakistan or Sri Lanka. But
Mm-hmm. Well, that's definitely true. But what kind of rents do you have?
multicultural, I would say, from day one, it's been a variety of everything. Indians, there are a lot of
No, the rent. How is the rent?
the rent. Okay, well, the rents. Giving you, I'm gonna give you very honest figures. If you are paying, let's say, 30,000 for a 1 BHK apartment in India, 30,000 Indian rupees. For the same apartment in Australia, in a city or in a regional place, you would be paying thrice the amount. So roughly about 85-90,000 is what you're going to be paying for a 1 BHK or a 2 BHK. It's as simple as conversion as it could get, as simple as I could make it.
Yeah. No, that is definitely true. That is there. It is, even if you are earning more, you are spending more over
Yeah.
here, so it doesn't feel the
Yes.
same.
And if a packet of chips costs you 20 rupees in India, it's going to cost you 100 rupees in Australia.
100
Yes.
minimum. Yeah, that's true. But I think once we move to other countries, we have to stop calculating in terms of rupees.
Exactly.
Otherwise, we have a really tough or a hard time in navigating our lives and expenses. But I also want to get down into when you said work-life balance. Can you tell us about how it is? Like in a week, how many days do you get off? What are your working hours like? Can we dive deep into that?
Sure. It's variable, it's eclectic. Ordinarily, you do not work more than 48 hours a week. If you are to work beyond that, you get paid handsomely. And by getting paid handsomely, I mean that if you're working overtime on, let's say, a weekend, you're paid more than 1.5 times the normal hourly wage. And if you're working overtime on a public holiday, any kind of public holiday, you are paid twice the hourly wage. For example, if you're paid $40 on a Friday morning duty, and if that Friday happens to be a public holiday and you're working on that, you'll be paid $80. And even if you're rostered on that, and there are opportunities to locum. You can locum as a junior doctor, senior doctor. You can locum for any other vacancy in your department. You can locum in some regional hospitals, and you can you can go down for a week and locum there. And locum pays you immensely well in Australia for all specialties, for psychiatry, for emergency medicine, for medicine on the wards, for acute care is where the maximum locum opportunities arise, and they pay you exceptionally well.
Okay.
So you've
that's
got this
interesting
professional
that 48,
opportunities also, time and again, and in abundance when you're in Australia.
Yeah. Okay. But that's good that it's just 48 hours a week, which was a crucial question. So probably you are getting 1 day or 2 days in a week off.
Yes, roughly, yes.
Roughly 1 or 2 days in a week off. Okay, so that's not bad. And what else can we know? That what is the cost of the whole journey, like from end to start? That is also one thing which a lot of students have a question about, I
Yes,
feel.
yes, surely. So I do talk about this a lot in my sessions, and the cost where accounting from exams, AMC 1 and 2 exams, and mind you, AMC exams are much more expensive than the US or UK or any other country counterparts. So if you take into account the exams, and let's say if you take into account a observership which you've done, a paid observership, those scars, but still there, what to do it? It will roughly amount to about 8 to 9 lakhs Indian rupees. If I
Okay.
were to round it, let's say 10
Before
lakhs.
you get a
Yes,
job.
before you get a job. But this is the whole process of tickets, applying applications, exams, observerships, etc. I'd say about 8 to 9 lakhs.
Of course.